Hello, I'm here today with Jerry Powell. He's a visiting assistant professor at RIT with the Health Informatics program. Jerry's previous role was the Chief Information Officer of a large health system, and we're going to start asking him some questions today around why it's important for the information technology operations in the health system. So, Jerry, as someone who has insight on technology, leadership's strategy setting, what are some of the top challenges that are being addressed, and why is it important to visualize these?
So thanks, Matt. Health systems today are faced with a number of challenges. Cost is one. Quality of care and improving patient quality of care is another. Engaging the patient in their care. These three are major objectives, and health systems are constantly looking for ways to improve all of them. And visualization could play a major role in helping health systems address those objectives. As you know, health systems, both providers and payers, are large, complex organizations. There are many people involved: physicians, nurses, therapists, and administrative folks that all need to be on the team in terms of delivering the best care possible at the lowest possible cost. Visualization, which is really a set of tools that sit on top of an analytics platform, which could play a role in not only showing data and information to impart knowledge and insight for healthcare workers, but it's also something where the healthcare workers themselves can use these tools to explore and dive deeper into the data to get other insights or discoveries that can help the organization grow. Yes, there are many challenges today in healthcare. Both data analytics and visualization can play a big role in helping those organizations become quality organizations to meet their very complex challenges.
So let's switch gears for a little bit and now talk about what are some of the exciting future trends in visualization that you see, and maybe some of the software that supports it as well. So what's the landscape around this, and what are you looking forward to?
Well, there are several new developments in software, in visualization, and data analytics that I think could play a big role in helping healthcare institutions meet their objectives. A great example of a new type of software is in geomapping, and this really is the intersection of looking at traditional maps and where patients reside, and doing risk profiles and other patient population type analysis. Another very new, exciting area is in the area of interactivity, and interactivity allows more people to use tools directly rather than having to go to a central group to get their reports or to get their information. They can use these tools more directly, which allows the data to go deeper in the organization and allows decision making to be more data driven in the organization. Also, in the area of self-service, we're seeing that more and more organizations are using self-service directly to get information, and it's in a non-traditional way. So all of these allow an organization to be more flexible, to achieve their strategic goals in ways that in the past were much harder to do, and it's broken down communication barriers in ways that allow the organization to become a true learning organization that is constantly improving and constantly reflecting on how they can innovate and discover and improve how they're delivering care.
Jerry, thanks. That's you've already really talked quite a bit about how to apply this to the health system on a more tactical level. Let's go strategic. So how do you get buy-in for this as a CIO, and what's the value proposition behind it for the organization?
Well, it is very important that there is buy-in at all levels, including the senior level, because these are major investments. To have a robust, strong visualization program, you need a good data analytics program, and to have a good data analytics program, you need a great technology infrastructure within the organization. And all that, of course, requires good management, good team building, and project management. So it really comes from the top, a commitment that the organization is going to be a robust learning organization that's committed to digital health and to driving better, more quality health care at lower cost through data, through information, and through organizational knowledge. So it is at all levels, but it really does start at the top. But if an organization can achieve that and does get to that level where visualization is throughout the organization, they're going to see a tremendous benefit, both in terms of giving quality care to patients, but also at the same time being able to reduce cost through looking at the most efficient, most effective ways to deliver that based on data-driven procedures and protocols, and by engaging patients in a way that allows the patient to participate more directly in their care. So it all sort of ties together, and it's a major commitment, but the visualization piece is a very important component of making this all sort of fit together in a very systematic way.
Jerry, this is great information, and it gives a lot of the students and myself even something to ponder as we move forward in our careers. I really appreciate your time, not only talking about some of the practical use cases, but also the importance of strategy behind visualization. Thank you.
Thank you, Matt.